Ahiphena poisoning, Papaver somniferum. Scientific classification is kingdom Plantae, clade Tracheophyte, Angiosperm, Eudicot. Order is Ranunculates. Family Papaveraceae. Genus Papaver. Species Somnifera. And botanical name is Papaver somnifera. English name is opium poppy seed or cuscus seeds. Sanskrit synonyms. General synonyms are Paniphena, Nagaphena, Ahiphena, Afayuna, Afim, Apuka, Aphenaga, Afuka. These are the synonyms of the fruit latex exudate opium. Kasatila, Tilabheda, Kakasa, Kakasatila are synonyms for opium poppy seeds, cuscus. Niryasa, an exudate obtained as exudate is obtained from the plant, it is also called niryasa. Tilabheda or kasatila because the seeds are similar to that of tila or sesame. Kshira or latex. So due to that, Paniphena latex is as strong as snake venom. Nagaphena latex as strong as snake venom. The two names Paniphena and Nagaphena. Afuka, a source of opium. Kasa, phala, kshira, injury is done to fruit yields latex. Ahiphena is saliva or venom of snake. Gazaphala kshira, Gazaphala udbhava. The milky exudate is obtained from the fruits, hence the name. Bija or seed, Sukshma bija, the small seeds. As if the stigmatic rays are present over the fruit, Sukshma tandula. Seeds that are good for health, Subija. Classical categorization. Dhanvantari Nikandu mention Ahiphena in Suvarnadi Varga and Upavisha. Rasatarangani in Upavisha. Bhavaprakasha Nikandu Haritakyadi Varga, Raja Nikandu in Shadahuvadi Varga, and Kayyadeva Nikandu Aushadi Varga. Varieties. According to the color of flower, Raja Nikandu and Nikandu Ratnagara mention Shweda, white flower, Pita, yellow flower, Krishna, black flower, Chitra, multicolored. So according to the color of flower, there are 4 varieties. And according to action, Charana digest food, Marana fatal, Dharana maintains health, and Sharana evacuate, Sarana evacuate waste. Parts used. Raw opium in inspissated juice. It is a dried latex obtained by the incision from the undried fruit capsule of Papaver somnifera. Poppy seeds. The seeds are collected from poppy capsules. Poppy straw. Dried opium poppies are referred as poppy straw. Phala niryasa. Milky juice of immature fruit. Phala, fruits, bija seeds, and bija thaila seed oil. So these are the parts used. Guna, Laguruksha Sukshma, Vyavai. Rasa, Tikta Kashaya, Vibhaga Kadu, Virya Ushna, and effect on Tridosha. Opium latex is Kabahara. It balances the Kaba dosha and increase Vada and Pitta dosha. Poppy seeds increase Kaba dosha and decrease Vada dosha. Ahiphena Shodhana or purification method as in Rasatarangini. Opium or latex of Ahiphena is dissolved in water, filtered, heated in mild heat till water evaporate. This paste is given bhavana with the fresh juice of ardraka for 21 times. Dosage. Opium, purified resin 30 to 125 mg, that is quarter to 1 guncha. Churna or powder 1 to 2 gram. Bija or seeds 2 to 5 gram. Poppy seeds are used in preparing foods, usually used in a dose of 1 to 5 gram in divided doses per day. Toxic part is opium milky juice and the opium derivative therapeutic dose. The crude opium is fatal dose 500 mg, morphine therapeutic dose 10 to 15 mg, fatal dose 200 mg, codeine therapeutic dose 10 to 60 mg and fatal dose 800 mg, heroin fatal dose is 50 mg, and tincture opium fatal dose is 3 to 4 ml. Fatal period is 45 minutes to 12 hours. This Ahiphena is a CNS depressant. Type of poison is neurotoxic somniferous poison or Sthavara Visha. Opium has about 25 alkaloid and divided into two groups, phenandrine derivative and benzyl isoquinoline derivative. Phenandrine derivative, it is a main narcotic constituent and it has a natural alkaloid, morphine, white color powder, bitter taste and alkaline in nature, and codeine, thebaine. Semi-synthetic opioid, they are produced by chemical modification of an opiate and include hydromorphone, diacetylmorphone, that is a heroin, brown sugar or smack, oxymorphone, oxycodone, and synthetic opioid. These substances are not derived from an opiate but bind to an opioid receptor and produce opioid effect clinically. It includes methadone, fentanyl, pentazocine, tramadol, and meperidine. And benzyl isoquinoline derivative, no significant CNS effect, and it includes papaver and noscapine. Opium. Opium is a dried juice of the white poppy, Papaver somniferum, when the capsule is still on the plant. It is dark brown or black and has a peculiar smell and has a bitter taste. Poppy seeds are white, harmless, demulcent, and nutritive and are used as food. The active principle, has about 25 alkaloid. Major ones are phenandrine, morphine, codeine, thebaine, isaquinoline, papaver, narcotin, and noscapine. The fatal dose is 2 gram, morphine 0.2 gram, codeine 0.5 gram, and fatal period is 6 to 12 hours. Clinical picture, stage of excitement and euphoria. There is an increased sense of well-being, increased mental activity, flashing of face, convulsions are seen in children. In stage of stupor, that is a stage 2, headache, nausea, vomiting, giddiness, lethargy, drowsiness, contracted pupil, cyanosed face and itching all over the body is present. Stage of necrosis, stage 3, deep coma, muscle relaxed, areflexia, pinpoint pupil not responding to light, hypotension, sweating, hypothermia, cyanosis, froth at mouth and nose, and Cheyenne-Stokes breathing also present. The triad of coma, pinpoint pupil, and depressed respiration 4 to 5 per minute strongly suggest opium poisoning. So, opioid overdose triad is a combination of the signs and symptoms that indicate an opioid overdose. So, pinpoint pupil, also known as pupillary miosis, unconsciousness, also known as drowsiness or decreased level of consciousness, respiratory depression, also known as hypoventilation or slowed or stopped breathing, are the triad, opium overdose triad. Management. Resuscitation, dehydration, IV fluid, airway suction or tracheostomy tube, ventilation, injection aminophylline or injection hydrocortisone. Removal of unabsorbed poison if the patient is conscious, oriented and having stable vital emesis. If not, stomach wash is done. Mild purgation by potassium permanganate and sodium sulfate solution 15 gram. Antidote mechanical is milk, chemical is nalorphine hydrobromide, and Ahiphena. In Anubana Manjari, antidote mentioned is Brihat Shudra juice with cow's milk, Vaja Saindava Pipali Madana Phala for Vamana, Tangana Tutta for Vamana. Acute opioid intoxication of mild to moderate degree usually does not require treatment. Patients with signs of respiratory depression, stupor, or coma need ventilator assistance. Naloxone, a pure narcotic antagonist, will reverse the respiratory depression and other manifestation of an opioid overdose. Treatment, gastric lavage, even for injected morphine as it is excreted in stomach. Enema purgative, high tension oxygen and coramine as cardiorespiratory stimulant, symptomatic treatment, and antidote is naloxone 1 to 2 mg IV every 5 minutes till patient become conscious and pupils dilate. Postmortem appearance. Postmortem appearance are not very characteristic, but signs of asphyxia are prominent. Smell of opium is noticed as soon as the chest is open. The intravenous addict would show linear needle track scar overlying the veins of the elbow, forearm, back of hands, and lower limbs. When fresh injection site is not noticed, nasal swab should be collected to identify the heroin snuffed by the addict. An external appearance are intense postmortem lividity, deeply cyanosed face, fingertips, frothing from mouth and nose. Internally, stomach small, soft, brownish limbs of opium, lungs are congested, trachea and bronchi have froths. Medical legal importance. Homicidal. Because of its bitter taste and characteristic smell, it is rarely used as a homicidal poison. Suicidal. Opium is commonly used as suicidal agent as they cause peaceful, painless death in sleep. Accidental. Overdose may occur in addicts, in children, or due to therapeutic misadventure. Cattle poison. It is used for doping race horses. Pinpoint pupils are the key features. It is answer A. Ahiphena. Dash is the toxic principle present in Ahiphena or opium, that is option D. Morphine. Exuding milk. Exuding milk is collected from dash of Papaver somniferum. It is unripened poppy capsule. In opium poisoning, weight in limbs and diminution of sensibility is initially seen in stage of stupor. So, stage of stupor or depression is in this stage the victim present with weariness, weakness, headache, giddiness, heaviness in limb, urge to sleep, itchy skin, and constricted pupil or pinpoint pupils. Usual fatal dose of opium is answer A 500 mg. Postmortem findings show combination of intense lividity of the face approaching blackness and edema of the lungs are the hallmark of dash poisoning, opium poisoning. So in hanging, the postmortem lividity or liver mortis is in distal parts of the hands and leg. Hydrogen sulfide poisoning, bluish discoloration, carbon monoxide poisoning, cherry red, cyanide poisoning, bright red, opium black, aniline, chocolate brown, phosphorus, dark brown color. Thank you for watching my video. For more updates, please like, share, subscribe my channel. Thank you.